Hi everyone, my name is Nima Padillo. I'll be presenting to you guys updates on cancer prevention. Let's talk about cervical cancer. It is one of the most preventable types of cancer. As you can see in this picture, this is what a normal cervix looks like, and this is what the last stage of cervical cancer looks like. In this speculum view, you can see how widely the cancer has spread in that cervical area. HPV virus, also known as the human papilloma virus, primarily targets the squamous cells. The persistent infection of the squamous cell causes the cervical cancer. The two notorious strains are 16 and 18. The primary mode of transmission for these strains are skin and mucous contact during sexual activity. Hence, the cofactors are early sexual exposures and multiple partners. Persistent HPV infections also cause cervical cancer, like I mentioned. There is a higher incidence in Blacks and Hispanics and above 40 years old. Other risk factors include multiple life partners, early onset of sexual activity, early teen pregnancies, multiparity, genital diseases, human papilloma viral infection, low socioeconomic status, poor genital hygiene, cigarette smoking, etc. There are different classifications of precancers and invasive cancer. Out of these 10, low-grade squamous intraepithelial lesion occurs primarily due to the persistent HPV infection. What are the most common signs and symptoms? The most commonly reported ones are postcoital spotting or bleeding, along with vaginal discharge and pelvic pain. Adenocarcinomas of the cervix have a worse prognosis than squamous cell carcinoma or any other adenocarcinomas. As you can see, stage 4 is almost less than 15%. Depending on what stage the cancer is diagnosed, the treatment offered may differ, but the treatment options right now are cryotherapy, laser therapy, excision. The success rate of these modalities may differ from 80 to 100% depending on the stage that the cancer was diagnosed. How can we prevent cervical cancer? The three-tier system of primary, secondary, and tertiary prevention and cervical cancer plays a very important role. Let's get into each one of them. The health education itself, what HPV virus is, how can it be prevented or how it spreads, that is very important. There are vaccinations that's offered from World Health Organization. It is recommended to get a 2-dose vaccination at birth and at 6 months or birth and 12 months. Encouraging male circumcision early on and safe sex practices using condom is also under primary preventative method. The two vaccines that's offered right now are Gardasil and Cervarix. These target different strains of HPV virus and they are given in different dose schedule. The efficacy for these vaccines range from 0 to 80%. These are offered between ages 10 and 25. According to the American Cancer Society guidelines, initial screening is recommended at age 21 with pap smear every 3 years or age 25 with HPV testing every 5 years. It is very important to continue screening between 30 to 65 in asymptomatic and immunocompetent patients. The following are acceptable: either HPV testing alone for every 5 years or a co-testing with PAP and HPV every 5 years or PAP testing every 3 years. You may discontinue after 65 years old, given the fact that you had adequate prior screenings or negative exams that does not warrant any extended screening. However, frequent screenings are recommended in abnormal PAP or patients with high risk, such as HIV, immunosuppression, or fetus that were exposed in utero to DES or inflammatory bowel disease or rheumatoid arthritis. The third stage is tertiary prevention, and this is the actual diagnosis and the management of the invasive cervical cancer. Depending on the stage, different treatment options are given, starting from cryotherapy, laser, excision, and success rate, like I mentioned before, is 80 to 100% if found earlier.